Allied health are really important. We're a diverse group of professionals. We bring lots of different skills and experience to what we do.
Allied health is a wonderful place to work. It gives you so many opportunities.
So the best thing about being a speech pathologist is being able to work with people with communication difficulties, to give them back a voice and help them to communicate with confidence.
Part of my role here at Canterbury is to provide a lot of education and training to our pharmacists, our doctors, and I guess obviously our patients. Make sure that the medications we provide, we dispense, are appropriate and safe, and that our patients get the highest level of care possible.
We wouldn't get our patients home in as timely a way as we do without the effort of all of the allied health team.
We have about 1,015 allied health professionals across Sydney Local Health District working in a variety of settings.
So I'm an occupational therapist by profession, and we work as part of the Allied Health Response team here in Shah, and it's providing all allied health support to patients while they're here. They're here because they have to be in quarantine, and it could be something as simple as organising colouring in for their child through to arranging psychological intervention or physical therapy.
Each day is different, and one day you could go from one family that's feeling this intense, they've had devastating news, to another family that are now having the adjustment, your loved one's now going to be transferred to another hospital and they're moving on, which is great, but then there's also other feelings and adjustments that they're experiencing. So you go between lots of different things in a day.
You see that change. They go from being in ICU to possibly not surviving the night to then walking out of the burns unit doors. That's why I chose to become an OT, to try and make a difference and work with my colleagues.
It's hard to see people actually in pain. Quite often we actually have patients coming back and they actually become really good friends, and that actually gives you the strength to actually keep going.
I think the best part will be in the future when I get to look back on it and really recognise and be proud that I was working really on the front line, and feel that I've really contributed to the country being able to still keep open and operating. So the best part is not now, I'm hoping the best part will be in the future.
It's an absolute privilege to work with allied health professionals, and I feel very blessed to be part of a multidisciplinary team where we can achieve such great results all together with all our different inputs. Happy Allied Health Day. Happy Allied Health Professionals Day.
Happy Allied Health Professionals Day.
Allied health are an amazing bunch of people.
Happy Allied Health Professionals Day.
Everyone have a very, very happy Allied Health Day.